As digital technology continues to dominate almost every aspect of our lives, healthcare is one area where technology is an increasingly growing focus. Just this week, CommBank Health and KPMG released a joint report showing how digital technology could significantly improve efficiencies in Australia's healthcare system. The Healthy Options report showed that 83% of Australians are currently satisfied with the quality of healthcare, with most believing that digitally enabled solutions could even improve that further with as far as patient experiences go and save the industry billions, providers time and money in administration, and to be passed back on to patients. Joining us today to discuss the report and its findings is CommBank Health Chief Executive Officer, Albert Naffer. Welcome, Albert.
Great to be with you. Thank you.
Now, 83% satisfied. That's a great thing. We can go further with this. Explain to me how.
Yeah, look, the vast majority of Australians have said they are satisfied with the healthcare outcomes and the healthcare system that they participate in Australia. But where they identified opportunities for improvement was along the lines of what you sort of just articulated in your opening there, the administrative side, some of the non-clinical, the non-medical parts of that experience. Along the journey when they go from their doctor to their specialist, to the hospital, heaven forbid if they need that experience, and then back again, they're having to continually, time and time again, share information. It's inefficient. It's not pleasant. It takes up valuable time that can be used to have a clinical conversation and hopefully better, deliver better clinical outcomes. And all participants in that journey, whether it be the doctors themselves, the payers, or the patients, have agreed that using technology that is so readily available in every other aspect of their lives can really help address some of those pain points that are still in the experience.
Yeah, I can imagine that one of the costs for doctors providing the services they do would be in the administration staff that they must provide, the front of office, constantly having to fill out forms, or even, as we were talking earlier, show up with a letter from a doctor to give to them to put on their file to then enter everything. That could all be done digitally and once.
You're absolutely right. Now, what doctors won't do is say, well, I'm going to save on a receptionist, but what it will allow them to do is to see more patients every day, right? By not having that time, wasted at the front counter, filing that letter, or writing out a letter, or opening envelopes and sending out snail mail, that information travels with the patient. Doctors are very good users of technology today. They all use practice management software to capture clinical notes, to get a better understanding of their patient. Yet there are breaks from that digital experience constantly, particularly when it comes to that moving the patient through the journey. And we've identified almost $1 billion in potential savings to the industry if we can get those digital experiences done much more effectively than they have in the past.
We've all seen those signs or the appointment letters that come out. Please make sure you bring any scans, x-rays, or information with you. That could all be done away with this.
Oh, of course, like these scans, these letters typically all start out in some form of digital form. And then they're printed out, they're turned into physical documents, and then sometimes then handed over to the doctor at the other side, who scans them and uploads them again as into a digital form. Again, there's no need to do this. There is a need, though, for investment across the board to ensure that this information both can be shared efficiently but safely and securely. But the upside is quite significant, both from a patient experience and satisfaction perspective, as well as the overall cost of running the system.
Well, where does the initiative start, though, Albert? We clearly see patients are up for it. We clearly see the medical profession up for it. Does it begin with the government, or does it begin with the medical profession saying to the government, we need this?
Well, that's the $1 million question. What we say in the report, what KPMG say in the report, is this requires collaboration. It's not up to just one party to try and lead or solve this, whether it be government or whether it be the medical practitioners, industry groups. It's about everyone getting together, understanding what good looks like. There's clear evidence now of the benefits of this move towards a more digitized, more connected patient journey. And then, how do you eat an elephant? One bite at a time. This is a big a big challenge, but it's a big opportunity that's got to start with some iterative steps. But it is through collaboration of all parties at the same time.
I could imagine it could even play a part in ambulances. It would be fantastic knowing where they're turning up to, what existing history there is, without having to try and gather and ascertain all of that. This could be such a game changer.
You're absolutely right. And sometimes when an ambulance is arriving at a scene, you know, a patient might be unresponsive, whoever's with them might not have the necessary information. A lot of this information, again, is stored in a medical healthcare, digital healthcare record somewhere. It's just a matter of making sure that we can safely and respecting all the privacy and confidentiality rules that we need to have that information readily available to travel with the patient, so that we can, again, make sure in the end, the ultimate objective here, there's one ultimate objective, delivering better clinical outcomes for Australians. Yeah,
we seem to be stuck back in the dark ages with the way we do a lot of these things. So, all right, Albert Naffa, Chief Health Officer from CommBank, thanks so much for your time.
It's a pleasure. Thank you.